Good day. My topic today is about abortion. What is the meaning of abortion? Abortion is considered as one of the most controversial issues. It is an argument between life and death. The uncertainty of its complications makes the issue more challenging to deal with. Abortion refers to the termination of pregnancy by removing the fetus or the embryo from the uterus before it is ready to take birth. Abortions are one of the most common methods to end a pregnancy. It is one of the safest procedures to terminate a pregnancy through medicine. An abortion that occurs without clinical intervention is known as miscarriage and occurs in almost 30% to 50% of pregnancies. Unsafe abortion can lead to maternal death. Hence, it is always safe to go to clinical procedures. What is the cause and effect of abortion? Abnormal genes or chromosomes. Like most miscarriages occurs because the fetus isn't developing normally. About 50% of miscarriages are associated with extra or missing chromosomes. Most often, chromosome problems result from errors that occur by chance as the embryo divides and grows, not problems inherited from the parents. Maternal health conditions. In a few cases, a mother's health condition might lead to miscarriage. Examples like uncontrolled diabetes, infections, hormonal problems, uterus or cervix problems, and thyroid disease. There are some risk factors. Various factors increase the risk of miscarriage, including first, age. Women older than age 35 have a higher risk of miscarriage than do younger women. At age 35, you have about a 20% risk. At age 40, the risk is about 40%. And at age 45, it's about 80%. Second is previous miscarriages. Women who have 2 or more consecutive miscarriages are at higher risk of miscarriage. Third, chronic conditions. Women who have a chronic condition, such as uncontrolled diabetes, have a higher risk of miscarriage. Fourth, uterine or cervical problems. Certain uterine abnormalities or weak cervical tissues might increase the risk of miscarriage. Fifth, smoking, alcohol, and illicit drugs. Women who smoke during pregnancy have a greater risk of miscarriage than do non-smokers. Heavy alcohol use and illicit drug use also increase the risk of miscarriage. Sixth is weight. Being underweight or being overweight has been linked with an increased risk of miscarriage. And the last is invasive prenatal test. Some invasive prenatal genetic tests, such as chorionic villus sampling and amniocentesis, carry a slight risk of miscarriage. There are some complications. Some women who miscarry develop a uterine infection, also called a septic miscarriage. Signs and symptoms of this infection include fever, chills, lower abdominal tenderness, foul-smelling vaginal discharge. What does not cause miscarriage? Routine activities such as these don't provoke a miscarriage. First, exercise, including high-intensity activities such as jogging and cycling. Second is sexual intercourse. Third, working, provided you're not exposed to harmful chemicals or radiation. Talk with your doctor if you are concerned about work-related risk. Often, there's nothing you can do to prevent a miscarriage. Simply focus on taking good care of yourself and your baby. First, seek regular prenatal care. Second, avoid known miscarriage risk factors, such as smoking, drinking alcohol, and illicit drug use. Third, take a daily multivitamin. Fourth, limit your caffeine intake. A recent study found that drinking more than 2 caffeinated privileges, they appear to be associated with a higher risk of miscarriage. Relevance in today's generation. Women's ability to access safe and legal abortions is restricted in law or in practice in most countries in the world. In fact, even where abortion is permitted by law, women often have severely limited access to safe abortion services because of lack of proper regulation, health services, or political will. At the same time, only a very small minority of countries prohibit all abortion. In most countries and jurisdictions, abortion is allowed is to save the pregnant woman's life, or where the pregnancy is the result of rape or incest. Abortion is a highly emotional subject and one that excites deeply held opinions. However, equitable access to safe abortion services is first and foremost a human right. Where abortion is safe and legal, no one is forced to have one. Where abortion is illegal and unsafe, women are forced to carry unwanted pregnancies to term or suffer serious health consequences and even death. Approximately 13% of maternal deaths worldwide are attributable to unsafe abortion, between 68,000 and 78,000 deaths annually. Women's organizations across the world have fought for the right to access safe and legal abortion for decades, and increasingly international human rights law supports their claims. In fact, international human rights legal instruments and authoritative interpretations of those instruments compel the conclusion that women have a right to decide independently in all matters related to reproduction, including the issue of abortion. My reflection is some of the general issues with abortion are the conflicts between pro-life and pro-choice. My issues with abortion are whether to abort or not to abort. However, I feel strongly about both sides. General pro-life advocates are for life no matter what the situation or what the person feels. General pro-choice advocates delve into people's situations and feelings and learn to understand why abortion needs to be a choice. Society needs to find a median between the two. I believe that all life is a miracle from God and we should cherish whatever is given to us from Him. Society needs to understand, and understand is the biggest word here. They need to research reasons as to why abortion is sometimes necessary, not just for the sake of a deceased baby, but maybe even for the sake of a mother who may not survive childbirth. I do not believe that abortion should be done if there is not a reason to, and that is where the stopping point should be. Because of these above reasons, abortion needs to be pro-choice within reason.